Good morning, wherever you are. This is Sage Harlan from ConferenceHype. Our segment will focus on systemic and ocular-associated factors for pathologic myopia in a highly myopic Chinese population, findings from the Wenzhou pathologic myopia study. From the 2026 July 22 edition of British Journal of Ophthalmology. Background AIMS. This study aimed to explore ocular and systemic factors associated with pathologic myopia in patients with high myopia and develop predictive models for differentiating between simple high myopia and pathologic myopia, particularly in its early stage. Methods. This cross-sectional study was conducted on 2767 patients with bilateral high myopia at baseline follow-up. Results. Among all patients, 1697 were classified as having pathologic myopia. Discussion. This study underscores the high prevalence of pathologic myopia in a highly myopic population and identifies ocular and systemic associated factors for pathologic myopia. From the 2026 July 22 edition of British Journal of Ophthalmology. Background. The present study aimed to systematically investigate modifiable factors for age-related macular degeneration using novel exposure-wide strategies in a large cohort, and then assess the preventability of AMD. Methods. Using data from the UK Biobank, a total of 331 modifiable factors from 7 categories were included. Results. A total of 478,867 UKB participants were included. Discussion. Modifiable factors across multiple categories are associated with AMD, and active interventions targeting these factors can reduce AMD incidence by 30.4%, 45.1%. From the 2026 July 22 edition of British Journal of Ophthalmology. Background AIMS. To evaluate and compare the diagnostic capabilities of advanced large language models in interpreting ophthalmological fundus images across diverse pathologies. Methods. We evaluated 8 leading multimodal LLMs, GPT-4.5, Claude 3.7 Sonnet, Grok 2, DeepSeek Cognition V2, QN272B, Gemini 2 Pro, Llama 3 405B, and Mixtral 8x22B, on their ability to interpret 100 fundus images representing various ophthalmological conditions. Results. GPT-4.5 achieved the highest overall diagnostic accuracy, followed by Gemini 2 Pro. Discussion. Current LLMs show promising but limited capabilities in ophthalmological image interpretation. From the 2026 July 22 edition of British Journal of Ophthalmology. Background AIMS. To report visual and anatomical outcomes following intravitreal hydroxypropyl methylcellulose for the treatment of chronic structural hypotony. Methods. This study is a prospective interventional case series. Results. Best corrected visual acuity logarithm of the minimum angle of resolution improved in 87.5% of eyes, with one eye remaining stable. Discussion. This is the first case series to use a structured protocol for intravitreal HPMC in chronic hypotony management.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 July 22 edition of British Journal of Ophthalmology. Background AIMS, to assess the short-term reliability and agreement of home-based visual field testing using web-based Melbourne Rapid Field software compared to standard in-clinic Humphrey Field Analyzer perimetry. Methods: cross-sectional study with a repeated measures design of one eye of 100 adult participants from the laser in glaucoma, an ocular hypertension trial with stable VFs with a questionnaire capturing participant feedback. Results: MRFweb showed greater test-retest variability than HFA for pointwise values, with a significant learning effect. Discussion: home perimetry produced more variable results than in clinic testing, but the increased testing frequency enabled the potential earlier detection of progression compared to standard in-clinic testing. From the 2026 July 22 edition of British Journal of Ophthalmology. Background AIMS, major age-related ocular diseases glaucoma, degeneration of macula and posterior pole, and diabetes mellitus with ophthalmic complications often coexist in aging populations, but their combined impact on severe visual impairment remains unclear. Methods: this nationwide longitudinal cohort study used data from the Korea National Health Insurance System National Health Screening Cohort from 2004 to 2019. Results: among 0.5 million participants followed over 7,495 390 person years, 7296 developed glaucoma, 1051 DMPP, and 3062 DOC. Discussion: the presence of multiple ARODs significantly elevates the risk of severe SICs. From the 2026 July 22 edition of British Journal of Ophthalmology. Background: this study aimed to evaluate the prevalence and risk factors of retinopathy of prematurity in preterm infants with a birth weight 1500 g or gestational age 32 weeks in Turkey. Methods: a prospective cohort study was conducted in 80 neonatal intensive care units between 30 September 2023 and 1 November 2024. Results: the study included 4140 infants at risk for ROP development, 242 developed any stage of ROP, and 17 developed severe ROP requiring treatment. Discussion: ROP in mature infants is rare but can occur in the presence of multiple risk factors. From the 2026 July 23 edition of British Journal of Ophthalmology. Background AIMS, the Early Treatment Diabetic Retinopathy Study 7-Field Protocol remains the reference standard for diabetic retinopathy severity grading, but is technically demanding, poorly tolerated, and covers only 35% of the retina. Methods: in this prospective study, 81 type 2 diabetes participants with ETDRS diabetic retinopathy severity scale levels 3547 underwent ETDRS 7-field color fundus photography and UWF imaging using Clarus 500 and Optos California. Results: compared with ETDRS 7-field CFP, Clarus and Optos showed strong agreement in doctor severity grading. Discussion: the peripheral retina alone does not show increased lesion severity, but extended UWF imaging integrating central and peripheral fields provides a more complete assessment.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 Jul 22 edition of British Journal of Ophthalmology. Background: to evaluate the effects of scleral ontophoresis lutein delivery on macular pigment optical density, retinal anatomy and function in patients with intermediate age-related macular degeneration. Methods: this prospective pilot study included 15 phakic eyes from patients with IAMD. Results: MPOD showed a significant overall change across time points, with significant differences between T1 and T3 and T2 and T3. Discussion: the inverse correlation between MPOD change and RS decline at 3 months raises the possibility that early augmentation of MP may provide a protective functional effect. From the 2026 Jul 22 edition of British Journal of Ophthalmology. Background: cycloplegic autorefraction may offer higher diagnostic accuracy than uncorrected visual acuity screening. Methods: this repeated cross-sectional study analyzed data from 33,642 kindergartners aged 5-6 years enrolled in the YLN myopia prevention and vision improvement program from 2014 to 2024. Results: among 33,642 participants, 3,206 were identified myopic, including 2,303 who were newly detected through cycloplegic autorefraction, yielding a diagnostic rate of 7.03%. Discussion: preschool myopia screening using cycloplegic refraction significantly improves early detection compared with 5A screening. From the 2026 Jul 22 edition of British Journal of Ophthalmology. Background: introduction, vacuoles, E1 ligase, X-linked autoinflammatory. Somatic syndrome is a recently described multisystem inflammatory disorder. Methods: this is a case series of VEXAS patients submitted by ophthalmologists from relevant specialty organizations, including the Australian and New Zealand Society of Ophthalmic Plastic Surgeons, British Oculoplastic Surgical Society, and the Orbital Society. Results: 14 males with VEXAS syndrome and eye features were included, median age 73 years. Discussion: orbital inflammation was a feature in all cases of VEXAS with eye involvement, and severe loss of vision occurred unilaterally in 14%. From the 2026 Jul 22 edition of British Journal of Ophthalmology. Background: to compare the outcomes of scleral fixated intraocular lenses in the pediatric population. Methods: a systematic review and meta-analysis were performed in line with the preferred reporting items for systematic reviews and meta-analyses guidelines. Results: 33 studies were included. Discussion: all types of scleral lens fixation showed improvement in initial outcomes.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the July 2026 issue of British Journal of Ophthalmology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.